This time, though, we're going to be discussing the risks
Of
involved
rimming.
with rimming.
Cool. I'm
Yeah.
excited for this one because, like you said, we talked about this before, but we didn't talk about the risks. Are there any risks? We're about to find out very soon.
Well, we did go over the risks in the other video, but this video is specifically
Right,
about the
right,
risks.
right.
Since the last video was a
Specifically.
little bit long, this one's going to be a little shorter to just let you skim through the risks to make sure you're educated ahead of time before you dive into rimming.
If you haven't watched the other video yet and you want to know more about rimming, please go back a few videos. You'll find out more information about rimming.
Yeah, but
Right?
let's dive into the risks and get started because people are waiting. They're curious. What are these risks?
Can you first remind us, because we don't know, what is rimming?
So rimming involves the use of the mouth and the tongue to stimulate the anus. And of course, this is an activity that can increase pleasure and intimacy between partners, but there are some health considerations you want to take into account before you decide if it's right for you. So
Yes.
historically and culturally, the perception or idea of rimming is definitely going to vary. Some see it as taboo, while others see it as a normal part of their sexual identity and their sexuality. So it's important to know that it can be very normal, but for you, if it's not something normal, there's no pressure. You don't have to add it into your routine. But if it's something that you're interested in, consider giving it a try. But before we do that, let's go over these risks.
Absolutely. And so, what are the potential health risks of rimming?
So the main concern we want to consider, of course, is the spread of sexually transmitted infections or diseases. We want to consider all of the options as the majority of them are transmissible through rimming. So things like herpes, syphilis, gonorrhea,
Right.
chlamydia, HIV, HPV, they can all be transmitted in some capacity. That being said, it is extremely rare to
Wow.
transmit HIV through a rimming activity. HIV does require the spread to be blood-to-blood contact, so there needs to be a cut on the anus and a cut in your mouth at the same time. So there's never been a proven clinically documented case other than maybe hearsay
Hmm.
or a case study where someone says that that was the only activity that they participated in, but never like a clinical trial or some sort of proven fact that it can occur. But hypothetically, it can certainly be an option. So consider protecting yourself from HIV during all sexual encounters. It is also important to note while we're on this topic that if your partner has HIV, but they are undetectable, meaning the viral load in their bloodstream is zero, due to the fact that they're on medication and suppressing the virus, it is impossible for them to spread HIV to
Hmm.
you. So that is something to also be aware of. You can also take medication yourself to lower your risk, something like pre-exposure prophylaxis, Truvada, or Descovy are the
Mm.
brand names. Those daily pills will reduce the chance that you would be infected with HIV.
Oh, that's great.
And most commonly, we worry about the bacterial infection spreading through this avenue. So things like chlamydia, gonorrhea, and syphilis can all be spread through rimming. And of course, there's also medication you can take after exposure to a potential person who has chlamydia, gonorrhea, or
Hmm.
syphilis called Doxypep. So it's actually an antibiotic called doxycycline. You would take 2 tablets within 72 hours of the exposure. And of course, you want to have this prescribed to you by your primary doctor or doctor
Right.
who knows your history so they can make sure it's an appropriate treatment for you. But again, other ways you can keep yourself safe if you're in that situation or want to try rimming and aren't sure about your partner's sexual history.